The population assessed during this 2-week period were patients with Alzheimer's disease, stroke, and depression, also dementia. The assessment tool used during the 2-week period is called the Recreational Therapy and Activity Assessment. This is used to Carolina goes in and does an assessment on a patient, and she asks them all kinds of questions like, do they like to read? Do they like to watch TV? Do they like to watch movies? Do they like to play bingo, dominoes, things along those lines? And then they rate it on a scale of 1 to 4, as previously stated in my report. And this helps with the reimbursement process of how St. Anne's gets reimbursed. This also helps with the client treatment, because then we know how to, based on the assessment, we know what kind of activities to put them in throughout the day. And if they like, and a certain case that I observed yesterday was that a patient likes to work on puzzles during the day. So what we can do is we can bring puzzles either to him in his room, or we can have him come to one of the activities rooms where they do puzzles, and he can work on that as he sees fit. But my one problem with the assessment tool that we have is that a lot of the questions follow what we do throughout the day, but there is one question that I feel does not fit in the assessment, and that is, where do you keep your belongings? A lot of times when we ask that question, the patients are like, well, I don't really care. The question was, where do you keep where would you like your belongings kept while you're at St. Anne's facility? And a lot of the times the patients respond, I don't really care, or I don't know, so that's the one thing I found during the assessment process that did not fit. Some of the programs that we implemented during this 2-week period, where we do a lot of balloon toss, they like to do a lot of bingo, a lot of dominoes, because it's just what they're used to. We did bowling with them, where we put them in like a semicircle. What we do is we split up the dining rooms, and we put them in like a semicircle in the different rooms. And some will do volleyball, and then with the table, where you use a balloon and you do like you do volleyball using the balloon. And then we did another room where we did a semicircle where you do bowling. And what they do is they throw the bowling ball from their wheelchairs, and they try and knock down as many pins as they can. We usually do about maybe 5 or 6 at a time when we do the bowling. And then another activity that we did was where you take a balloon or a ball, and you try and keep it up in the air with a parachute. And what that does, that helps with their muscle tone and stuff like that, where they can move their shoulders. Some personal insights that I have about program implementation is just how, like when we do the balloon toss, and how when we do the different activities with them, how much they come to life, and how much you realize they really can move. Because a lot of times, when they're sitting in the wheelchairs in the hallways, they don't look like they can move. But once you start them on the activities, and they start kicking their legs and moving their arms and becoming more reactive to what's going on around them. So I found that to be very interesting. Some of the other activities that we did during this 2-week period was I observed Carolina conduct a group that she put them in a semicircle again, and then tossed a ball around, a ball from the Alzheimer's Association, which had questions on it. And each time, before she would throw the ball, she would ask them the question, and then they would catch the ball, and then they would have to answer the question and then throw it back to her. And that worked on both their physical and mental conditioning. at St. Anne's, we document on whether they attend an activity or not, and whether they're passive or active during the activity. If they're active, we can tell whether they're enjoying the experience or not. But sometimes they're passive, which means that some of the patients, because they of the Alzheimer's and dementia and stuff, don't respond during an activity. I personally, I had a patient who I was doing music with, and she had Alzheimer's disease. And one day, during the middle of the activity, she just decided to go into like a sleep mode. We knew she could hear us because she was moving around and stuff, but she would not respond. So it depends on the day, whether on how they respond to the different activities and how they're feeling, and if they want to be involved or not. It's if they don't want to be involved or not, we don't force them to be. It's totally up to them. Say if they want to stay in their room or not. If they want to stay in their room, they can. If they want to come out to activities, they can also do that as well. We don't force them to do the activities if they choose not to. But as far as documentation, we document before, we'll do the assessment, and then we'll document how it needs to. Then we decide on who gets into certain activities. We try and tailor it as much as we can to the individual's personal needs. But a lot of the activities at St. Anne's, except for the stuff I do at with the iPad, and some of the other interns do one-to-one interventions in the bedroom, in their like bedrooms. Other than that, I believe the main thing is group activities is what we basically work on. And when we do that, either the interns or the staff document on what we call the ECS, and that's how Carolina. It's called the Electronic Charting System, or ECS, and that's how Carolina documents on whether a patient is going to activities or not, how they're responding in activities, whether they're passive or active. And that's basically how we document. First, we take the assessment tool, and we originally give them when they first come in, or we do what they quarterly or annually, and then we take the assessment tool and we try and tailor the activities as much as we can to their own personal needs. Like the example of an individual doing a puzzle or something like that. And then we entered into the ECS, and that's how Carolina keeps track of all of the documentation that we do. So that's how we do documentation.